And this is not a very popular protraction in here. It's also called suborbital protraction appliance because it takes anchorage from the forehead, the square framework, and then it takes anchorage from the cheek pads also. But there is a big disadvantage in this face mask because there is no control on the mandible. Only the maxilla will get protracted. So if you have a normal mandible and a retrognathic maxilla, then this would be very ideal. And this is Nanda's modification where the intraoral appliance will have a headgear tube and the inner bow will enter into the headgear tube from the distal. Understood? And then this is a petit face mask. You have this wire and from the outer bow to the appliance wire, elastics are used. This is Nanda's modification. Now coming to treatment timing, as I told you, class 3 patients, even if you look at the textbook Vanarasta, he says class 3 patients, the class 3 skeletal pattern develops very early in life. Soon after you are born, in your mixed dentition itself, sometimes it develops. Unless it is a pseudo class 3 with some incisors erupting in abnormal positions. Real skeletal class 3 develops very early in life and it continues to grow the same way. And it has been found that the pubertal spurts also, in a class 3, in a prognathic mandible also, it has been found that the mandible does not grow more during the pubertal growth spurt in a prognathic mandible. It grows the same way like how a class 1 mandible grows. So that means to say, very early in life, the class 3 pattern is set and it continues the same way. So as early as possible, you should start treating your patients. So if you look at Vasetti, it says primary, even primary dentition you can start. Okay. Now Prophet says you can get very good skeletal change up to the age of 8 protraction. After that, you may just get a clinical success. You may jump the weight till about 10 years, 11 years. And if you look at most of our textbooks, they say the maxillary growth ceases after 11. Ceases in the sense it will have growth, but it will follow the general body curve. Like any of the other skeletal tissues. You will not have, after the age of 11 years, it is the mandible which starts to grow in excess. Peter Yang, who is one of the masters of class 3 correction, he also says, as early as possible, initial eruption of upper central incisors and the molars, because you need some sort of an anchorage. So he says start at this age. Now the magnitude of force, Nanda says 5 to 8 years, 250 to 250 grams. Why? Because most of the teeth are digestive. Then 8 to 11 years, 300 to 450 grams. And 12 years and above, 450 to 500 grams. Profit 350 to 450. For everything Profit says 350, 450. Graeber says you start with 200 grams, as the patient gets used to it, proceed to 300 grams, and finally you can end up with 600 grams. McNamara says use 300 to 500 grams. According to how the patient can take it, you keep increasing the force. Direction and point of force application. Now, when you are having a face mask, if you pass the force through the center of resistance, you will get transmitted. But what is happening in our appliance? Most of the appliances are fixed onto the teeth. So, the point of force application is standing below the center of resistance. So, you will always get an open weight. So, it is recommended that you angulate your elastics at 30 to 45 degrees so that you will not get an open weight. But it is said that even then 1 to 2 degrees the occlusal plane can tip up anteriorly. You must be careful of not landing up in an open weight whenever you use a Duration of force for pre-adolescents 10 to 12 hours, adolescents 12 to 16 hours being under, profit 12 to 14 hours. And Graeber also says full time as much as possible you wear. But one thing is, when you're giving splints, you must be careful because there will be a lot of teeth to erupt also, and you are not allowing the eruption of the teeth because your deciduous teeth are in the splint. So once in a while you have to remove the splints, you have to take X-rays, and accordingly you will have to extract the deciduous teeth. Petit says use 800 grams. Petit is a big class 3 man. He does a lot of cleft lip and palate cases, and he does a lot of face mask therapy for cleft patients. And he's a master. He says use up to 800 grams per side, 24 hours. McNamara also says you have to use the reverse pulled face mask full time. Now, what you must remember is when you are delivering your face mask, what you must remember is there is a reciprocal force on the mandible. And so when you get a new face mask, just simply don't deliver it like this, because the reciprocal force will be traveling in a horizontal dimension. That will cause your mandible to elongate still furthermore. So what you must do is, you must take a 3-prong plier and bend that so that the chin cap will have the forces traveling through the condyle. That is where the force should go, not like this. So don't deliver a face mask straight away like that. Now, these are the effects of the face mask. You will get the maxillary displacement, mandibular downward rotation, ANP will improve, your inside upper will procline, lower will retrocline because of your chin cap. These are the people who support expansion with protraction. These are the people who don't support expansion with protraction. Now you can, after your protraction, you can give an FR3 as a retention appliance, or you can even give a chin cap if you want. Coming to chin cap, classification, one is the occipital pulled chin cap. This is used in horizontally growing patients where the mandible will tend to rotate backward. This is the vertical pulled chin cap where the mandible will rotate anti-clockwise. Patients having open bite tendencies, you can see it is a vertical pull. These are the effects. Okay. So now what happens in a chin cap? Where is the action? The condylar cartilage is reduced in size, and then the chondrocytes are also less. Again, treatment timing as early as possible. Peter Nyan says you can do it even in the primary dentition. You can give a chin cap. Magnitude of force, again, from various authors it differs. Duration also, some say 14 hours, some say just night time, some say full time, and it can go up to 4 years chin cap therapy. Stability, many authors say like Sakamoto, Wendell, Deguchi, McNamara, they say yes, there is some reduction in mandibular growth. But there are a lot of people, including Graeber, who says the chin cap doesn't work, it only rotates the mandible backward. This is one of my studies which I did to study the effects of the high-pulled headgear on the cranium, because there is always a reciprocal force. And we found that the cranium is being affected, it is prevented from growing further, and indirectly it affects the growth of the brain. The rest I will not tell you. Please read the article. So I should thank Dr. Thiru and his team and the Madras Orthodontic Study Group for inviting me to talk over here. And I'm honored and I'm happy to see so many participants. Thank you.
Thank you, sir. We are grateful for the wealth of knowledge you have shared with us today.